Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Class 3 beta class 3 drugs mainly include the potassium channel blockers. So in the potassium channel blockers, amiodarone, bretylium, ibutyllite and dophytylite are important. So first amiodarone. Amiodarone is it is the most efficacious drug is amiodarone. This amiodarone is actually a broad spectrum drug which is long acting with a half life of around 100 days. They have a half life of around 100 days. And this amiodarone is a cumulative drug. Cumulative drug in Cumulative drug means even after stopping the drug effect will persist for some days. So in amiodarone, even after stopping the drug, the action or the effect actually the effect of the drug will persist for some months. Like in amiodarone, it persists for 1 to 3 months. Then it is metabolized by CYP enzymes, that is cytochrome P450 enzymes. It is metabolized by CYP3A4. Uses of amiodarone. Amiodarone is mainly used in atrial arrhythmias. It is used in atrial arrhythmias. That too, it is used in the maintenance phase of the atrial arrhythmias. It is used as drug of choice for prophylaxis of arrhythmias. So for prophylaxis of arrhythmias, we can use amiodarone, whereas for atrial arrhythmias, for maintenance we can use amiodarone, whereas in acute atrial arrhythmias also we can use amiodarone but the drug of choice for acute atrial arrhythmias is not amiodarone. The drug of choice for acute atrial arrhythmias is intravenous ibutylide is the drug of choice for acute atrial arrhythmias. Amiodarone is used to treat all types of arrhythmias. It can be used in all types of arrhythmias except one. So amiodarone is not used. So amiodarone is not used in the treatment of one type of arrhythmia, which is polyventricular tachycardia. That is polymorphic ventricular tachycardia is not it is not used to treat. Why? Because polymorphic ventricular tachycardia is actually a side effect which is caused by the amiodarone. If the amiodarone causes this polymorphic ventricular tachycardia has a side effect, then amiodarone cannot be used in the treatment of polymorphic ventricular tachycardia. Then the side effects of amiodarone. Amiodarone will result in different side effects. Among them, the pulmonary fibrosis is the most common side effect. This pulmonary fibrosis can be detected by doing the diffusion capacity of lung for carbon monoxide test, which is shown to be decreased in pulmonary fibrosis. So this pulmonary fibrosis mainly occurs due to the destruction of the type 2 pneumocystis. The type 2 pneumocystis are destroyed by the amiodarone. Amiodarone can also cause other side effects like respiratory symptoms like dry cough and breathlessness can be seen. The side effects are mainly seen when the cumulative dose of amiodarone is around 200 milligrams. Amiodarone can result in hypothyroidism, where it causes hypothyroidism by blocking the thyroid peroxidase. So amiodarone blocks the thyroid peroxidase and thus it causes hypothyroidism. Amiodarone also blocks the conversion of T4 to T3 and thus activation of the thyroid hormone is also blocked by amiodarone. Amiodarone can also result in iodine overload leading to hyperthyroidism. So amiodarone is a drug which can cause both hypothyroidism and also hyperthyroidism. Then amiodarone will also, the other side effects are it can cause Amiodarone can cause hyperpigmentation, especially it causes brown hyperpigmentation. It can cause hepatitis, that is, it can cause granulomatous hepatitis. It can cause fatty liver, especially in the beginning, it causes fatty liver. Then amiodarone can lead to the formation of microgranuloma and it can cause cirrhosis in the patients. It can even cause neuropathy, visceral constipation. It can cause neuropathy, visceral constipation, and amiodarone can also cause corneal microdeposits. But these corneal microdeposits will not interfere with the vision. Then amiodarone can also result in photosensitivity also. So these are the main complications of amiodarone. Side effects of amiodarone. So amiodarone can cause both hypothyroidism and hyperthyroidism. It can cause microcorneal microdeposits, though not interfering with vision. It can cause hyperpigmentation and granulomatous hepatitis.
Thank you and thank you for watching.